יש לך משהו, איזה פלסטר כאן? כי אני מדמה.
Israel throughout COVID excelled in several things, probably the vaccination campaign, also testing. Other things probably we did much worse, such as the number of cases per capita, also closing schools throughout the year. And currently, actually, Israel succeeded to delay the entrance of Omicron comparing to other countries, and this gave us some time for preparations. Some of the time we took for raising the vaccination rates. We could do better, for sure. Last year we were afraid that we're going to suffer from flurona, it's called. It's a combination of influenza and corona. All over the globe, last year there were no cases of influenza. This is not the case right now, and unfortunately we entered the winter with already very overwhelmed internal wards in hospitals. We have cases of influenza, even severe cases and deaths. And on top of that, now we're going to have Omicron, and the combination is probably going to be quite overwhelming. This is why we need to prepare the healthcare system, both hospitals, but even more important, the community. Israel was one of the first countries to recognize this fact, and this is why we closed the skies for non-Israelis in order to buy time. The current wave of pandemic is something that cannot be prevented. We are operating in a way that we are mainly interested to see that the hospitals and the healthcare system are not collapsing, and this is probably the main indicator. On the other hand, since we have vaccines and also drugs, we are much better equipped than exactly a year ago. I think that one of the major lessons we have from the pandemic is that we cannot take a global health problem and deal with it just on the national level. This is true for vaccine nationalism. We must move to vaccine internationalism. We are all in the same boat, and if we're going to see the continuation of gaps between countries, this is the fertile ground for more and more variants.